Over the years, I always felt very strongly that the registrar was the entrance to the hospital for both for patient care and for the revenue cycle. We found that patients could have as many as 50 or 60 records in our system because each time they came in, they gave us a different name, different address, a different social security number, and so they just kept compounding all these different records. How is fraud involved? Yes, you do have a number of patients, as I've mentioned previously, who come in and they give you somebody else's name. They might have stolen somebody else's identity, those types of things. Having Imprivata PatientSecure really makes that go away. We had probably only had it up and running a month at one of our hospitals, and we had a patient who had surgery, went home, came back, and said to us, "I need to tell you that I was using my brother's insurance." There's a number of those kind of situations, and what happens then is if that is found, then you need to return the money to the insurance company, and you're out that money. The way I presented this, and the way that was always the most important to me, was it's a patient safety issue. And a number of emergency room physicians I've spoken to have said they really do worry that records can get mixed up and that they could make a clinical error in the emergency room. The benefits immediately we saw when we implemented Imprivata PatientSecure were many. The first thing that I saw was it very definitely was a tool for the registrar to give them some confidence in that they're selecting the right patient. Patients loved it. It was the most amazing thing. All the compliments from patients were positive. We just never had a situation where a patient complained or thought it was too invasive or anything like that at all. Very definitely from the beginning, one of our areas where we saw a really big return was in the financial assistance area. Some of the advantages to the revenue cycle relate specifically to being able to identify the patient as an individual patient every time that they come in. Previously, when they gave different names each time they came in, you just wrote those off as bad debt. But now you have an opportunity to pull those all together, have somebody work that in the financial assistance area, and to actually gain reimbursement for that patient, not only for the times that they've just recently been in the hospital, but for the future.